Uterus, it is a hollow, thick-walled muscular organ that lies in the lesser pelvis. Situation: it is situated in the lesser pelvis between the urinary bladder and the rectum. See the uterus. Urinary bladder is present anterior to the uterus and the rectum is present posterior to the uterus. Shape and measurements. It is a pear-shaped organ, that is, one end is larger and one end is narrower. It is pear-shaped organ and measures about 7.5 centimeters in length, 5 centimeters in breadth and 2.5 centimeter in thickness. Parts are subdivisions. The uterus is divided into two main parts: an upper, large, pear-shaped part known as body, and a lower, small, cylindrical part known as cervix. The junction between the body and the cervix is marked by a constriction known as isthmus. The upper, expanded or distended dome-like end that is present above the level of the uterine tubes known as fundus. So you have body, cervix and fundus. Position. The position of the uterus is anti-eversion and anti-flexed. Anti-eversion, it is the angle formed between the long axis of the vagina and the long axis of the cervix of the uterus. It is usually 90 degree. Anti-flexion, it is the angle formed between the long axis of the cervix and the long axis of the body of the uterus. It is usually 170 degree. Okay. According to some authors, it is 120 degree. Cavity. The cavity of the body of the uterus is pear-shaped and the cavity of the cervix is spindle-shaped. The cavity of the cervix communicates superiorly with the cavity of the body of the uterus through the internal os, and with the cavity of the vagina inferiorly through the external os. Ligaments. The ligaments of the uterus are classified into two types: false ligament and true ligaments. The false ligaments are the peritoneal folds and they do not provide any support to the uterus. The true ligaments provide support to the uterus. The false ligament include: number one, broad ligament which stretches from the lateral margin of the uterus. Number two, uterovesical fold, that is a fold of peritoneum which lies between the uterus and the vesicle, that is urinary bladder. Number 3, recto-uterine fold that lies between the rectum and the uterus. Number 4, recto-vaginal fold. It lies between the rectum and the vagina. So these are the 4 peritoneal folds which forms the false ligament. True ligaments. The true ligaments includes number 1, a round ligament of the uterus which stretches from the cervix of the uterus to the labium majus. Number 2, pubocervical ligament. That is, it is a ligament which stretches between the pubis and the cervix of the uterus. Number 3, transverse cervical ligament. The transverse cervical ligament stretches from the cervix of the uterus to the lateral wall of the pelvis. Number 4, uterosacral ligament. It stretches from the cervix of the uterus to the second and third sacral vertebrae. So, number 1, round ligament of the uterus. Number 2, pubocervical ligament. Number 3, transverse cervical ligament. Number 4, uterosacral ligament. So these are the true ligaments and it gives supports for the uterus. Blood supply. The uterus is supplied by right and left uterine arteries and ovarian arteries. Venous drainage, the right and left uterine veins and the ovarian veins drains the uterus. This in turn drains into internal iliac vein. Nerve supply. It has both sympathetic and parasympathetic nerves. The sympathetic is by uterovaginal plexus of nerves. The parasympathetic is from pelvic splanchnic nerves. Lymphatic drainage. The lymphatic drainage of uterus is clinically very important because the cancer spreads through the lymphatic channels. The fundus and the upper part of the body drains into pre and para-aortic lymph nodes. The lower part of the body drains into external iliac lymph nodes. The cervix of the uterus drains into internal iliac lymph nodes. A small part of the uterus, which is near the lateral angle where the uterine tube is attached, drains into inguinal lymph nodes. Structure. The structure of the uterus is made up of 3 layers. Number 1, perimetrium. Number 2, myometrium. Number 3, endometrium. Perimetrium. It is the outer peritoneal covering and it is derived from the broad ligament, which is nothing but the peritoneal fold. Myometrium. It is the middle thick layer which is made up of smooth muscle fibers. Endometrium. It is the inner mucous membrane layer which is lined by ciliated columnar epithelium. The endometrium also contains the uterine glands or endometrial glands and spiral arteries. Supports of uterus. The uterus has muscular support, visceral support and ligament support. The muscular support includes pelvic diaphragm, perineal body and urogenital diaphragm. The visceral support includes urinary bladder, vagina and the axis of the uterus. The ligament support includes number 1, round ligament of the uterus, number 2, pubocervical ligament, number 3, transverse cervical ligament, number 4, uterosacral ligament. Clinical anatomy. Fibroid uterus. They are benign tumors formed from myometrial cells. It is usually asymptomatic. Asymptomatic fibroid uterus requires no treatment. If large, hysterectomy is done, that is surgical removal of the uterus is done. Cervix carcinoma. It is the most common cancer in female. It spreads directly to the adjacent structures through the lymphatics. One of the main factors for cervical carcinoma is early sexual exposure. Thank you.